Now, when you solve the NCLEX-RN style questions, remember every NCLEX-RN examination question, the practice question, can be done in a different way. So every question has their own strategies. So today in this class, I'm bringing one of the strategy in front of you just to explain you how to do this type of question on the screen if you can see it. So in this question, if you see, it says a client examined in the healthcare clinic and has been diagnosed with hypertension and has been taking a prescribed antihypertensive medication. On a follow-up visit, the client says to the nurse, "I don't understand why I have to take this medication. It makes me feel awful. What is the most appropriate nursing response?" So this type of question we call the response type of question, and response type of question has about different strategies as well. But again, I'm bringing only one strategy today in one of these styles of question with you. So in these questions, the first strategy which I would like to talk about is about look at the keyword of the question. The keyword of the question is patient is asking you something about the explanation. So the answer for this question, number one, based upon the question what the patient asked, and it has to be the reply back to the statement. Okay, always remember, number two, do not change the topic of the client. Make sure as being as an RN, you need to reply back to the statement. So sometimes, we see the answer and we feel like, oh, that could be sounds like a good answer, but that's not actually the reply back to the statement. So make sure you're looking for reply back to the statement. Okay, so I only give you two tips so far. Now, number third, it also says in this question that what is the most appropriate nursing response? So most. Now remember, if the question asks you what is your first response, the answer could be different. But if the question asks you here what is the most or the best appropriate nursing response, the answer could be different because every word has their own meaning in the NCLEX style questions, and I can guarantee for that. Now, in this question, they're asking for the most appropriate, right? So that means you need to look for something which you have to say to the client as a part of the response, right? Now, if you look at the first point says you will need to ask your doctor about that. Ask yourself, right? It says you need to ask your doctor and the patient asking you something as a nurse, right? Is this something relevant and appropriate? You're just telling them, oh, you go and ask the doctor about it. Not a good idea, right? Second number, it says here, everyone who took some medication, they said the same thing, right? Comparing with another patients on the floor is a non-therapeutic communication technique. So if you don't know about the therapeutic, non-therapeutic communication techniques, make sure you read about it in the fundamental. Now, the third point says you have to take this medication. Okay, I'm not even going to read the rest of the statement. Why? Because when I see the first half of the statement, it sounds like to me, I'm trying to forcing my patient to take this thing, right? And that's again, non-therapeutic statement, right? Now, we already eliminated 3 of the answers. So that means the last answer, even if you don't read about it, that's the right answer. So this is what we call elimination technique, right? Now, if you see the last part, it says describe what do you mean when you say that the medication makes you feel awful? Okay, the nurse tried to explore here, right, about the client feelings, about the client statement. Because in question it says, it makes me feel awful. And we don't know what's the awful meaning is in here. So it's better to clarify with the patient. And clarification, checking the client's feeling is a part of the therapeutic nurse response technique, right? This is a therapeutic communication technique, right? So make sure you do understand for this examination, right? There are a lot of therapeutic and non-therapeutic communication technique for this examination. And once you know what they are, it will be very helpful for you to solve some of the questions, right? If you find this video really helpful, don't forget to like this video and share with your friends as well so they can learn something out of this video as well. Thank you so much for watching this video.